Good evening, everybody. My name is Premere Session. Welcome to our session tonight for Community Conversation Series. On behalf of Cedars Sinai, welcome to the open house, a special community conversation about the COVID-19 vaccine for children ages 5 to 11. My name is Premere Session. I am the Associate Director of Cedars Sinai Healthy Habits Program, and I'll be your moderator this evening. Healthy Habits is a signature community benefit program of Cedars Sinai that provides health education services, knowledge, and skills to children and families on making healthy lifestyle choices. At Healthy Habits, our overall goal is to reduce the risks and impacts of obesity in the communities that we serve. And we strongly believe it's never too early to develop healthy lifestyle habits. Currently, we partner with 21 LAUSD elementary schools and provide fun, interactive programs to over 3,000 students a year throughout Los Angeles to engage not only students, but parents and teachers in learning about healthy eating and physical activity to improve their health and the surrounding communities. We are proud to serve the community in this capacity and contribute to one of Cedars Sinai's missions, improving the health status of the community. I am so very honored to be a part of this conversation as it pertains not only to the community that we work with daily, but also myself being a parent of 3 younger children. We have really amazing programs, and we also will be sharing links out tonight of services that we provide, resources that we provide to encourage not only the families that we serve, but all families out there that are looking for some activities for their students and for their families and children to participate in. We'll also be sharing some links that Healthy Habits has about physical activity videos and delicious healthy recipes that are quick, simple, and easy to do with your family. This evening's presentation is available in English and with a Spanish interpretation for those who are joining via Zoom. On the bottom of your Zoom window, you can click on Interpretation, then select Spanish to hear the interpreted language only. Click Mute Original Audio. We're ready to get started, and we know all of you joining us today have lots of questions about COVID-19 vaccine for your children and the children in the community. And we have Cedars Sinai experts here to answer them. So let's go ahead and welcome them. Joining us this evening, we have Dr. Arthur Cho, Director, Division of General Pediatrics, Medical Director, Coach for Kids. Dr. Kyle Monk, Pediatrician. It's great to see you all. And Dr. Priya Soni, Pediatric Infectious Disease Specialist. They will provide their expertise in helping us understand about how the pediatric vaccine was developed and tested and what its approval for this age group means for children and how it may help us fight in our fight against our COVID-19 pandemic. We're also sharing in the chat links some of the animated videos, like I mentioned earlier, that we also have in English and Spanish that explain how the COVID-19 vaccine works. We look forward to a very informative discussion and welcome all questions. Please use the Q&A feature in Zoom to submit your questions to our doctors. We'll try to get to as many as our questions that come through by the end of the program. Again, thank you all for joining us this evening. I'm ready to get started. I hope all the viewers are ready to get started. As we begin, I'd like to give our panelists the opportunity to discuss the latest COVID variant of concern, Omicron. This has been detected now in California. I'll start with you, Dr. Soni, and encourage Dr. Cho and Monk to jump in where comfortable. What do we know about Omicron variant and how it affects people and its response to the vaccines that are currently available? Dr. Soni.
Thanks so much, Premere. Thank you for having us here tonight to discuss these important issues. I wanted to just kind of start by saying that Omicron variant is something that we are following very closely. We're still very much in the early stages of understanding exactly its impact on us and moving forward with the pandemic. And so far we know that it is seeming to be more transmissible than the prior Delta strain and variant. And we don't know exactly what that means with regard to clinical symptoms. So far, it does seem that those that were impacted with Omicron variant in various parts of the world have milder disease so far, and few have been hospitalized, but we still need more time to kind of understand the impact of this variant and where it's going to head in the future and in the upcoming year.
Thank you for that response. And thank you for answering that question and just giving us more information. I'm sure many of our parents watching tonight are concerned about that Omicron variant. So we'll go ahead and turn over to the topic of the evening, which is vaccinating our children ages 5 to 11 against COVID-19. Dr. Soni, I'll come back to you. More specific question. Recently, the FDA and CDC recommended that the Pfizer BioNTech is safe and effective for children ages 5 to 11, leading many parents to breathe a sigh of relief. As your specialty and as a specialist in the pediatrics infectious disease, please tell us your reaction to this news and why it's important to get this age group vaccinated.
Well, I'll start off by saying that most of us all are very excited that we're able to offer this vaccine for this important age group, the 5 through 11-year-olds. What we knew about the pandemic earlier on has changed to what we know now. And I will start by saying that earlier in the pandemic, what we were seeing is that less children were being infected. We were mostly seeing infections in older adults. And that has sort of shifted now, well over a year, almost 2 years into the pandemic, where children are now making up about 25% of new cases of COVID-19 every week. So that's huge. So our previous sort of idea of, oh, children aren't getting infected by this, they're not being impacted is totally wrong. And I would first start by saying that now we have we have a really great way to protect them while they have returned to school. We know about some of the impacts on them missing so much school, but also the impacts of this infection on them specifically. It's a very variable infection in kids. Some kids may have mild disease and some may be hospitalized, and the hospitalization rates have actually now surpassed those of prior influenza seasons with kids with COVID-19. And so we know that our hospital systems are being filled with these children who have active infection, and not to mention some of the more unknown long-term consequences that we're seeing in kids. And I'm sure Drs. Cho and Monk will agree that these kids we're often seeing with long-term COVID, having issues with fatigue, concentration, that kind of a thing. Not to mention MISC, which is another very dangerous occurrence that can happen after acute infection in kids, which stands for the multi-system inflammatory syndrome in kids. So there's a lot of different ways this disease is impacting kids. And ultimately, I'm just very happy that we are able to protect them now with the vaccine.
Well, thank you for that. It's really great to hear those rates and very powerful to hear. So I have a question for you, Dr. Monk. Throughout this long pandemic, we've learned that older people and those with underlying health conditions are most at risk for hospitalization and death from COVID-19. And yet we have seen COVID in young children, sometimes resulting in hospitalization and death, as Dr. Soni was just referencing. Can you share with parents watching tonight some of the short-term and long-term risk of COVID infection in young children?
Okay, I sure can. And I want to echo what you was just saying about the excitement of actually having a vaccine and something that we can offer to these families that have been fearful of their children returning to school, and the children themselves also experiencing symptoms and being fearful of, getting back to their regular life. But earlier in the pandemic, we were seeing older people and people with comorbidities being hospitalized and having increased death rates. But we still are, seeing children affected by this virus. Over, 7 million children have been affected with COVID since the start of the pandemic. Some of the short-term side effects of COVID in children often mirror the symptoms that we see in adults, such as fever, sore throat, respiratory symptoms, and fatigue, and oftentimes asymptomatic. So the majority of the cases that I've seen are, short symptoms and not ongoing symptoms, but that shouldn't take away from some of the kids, as Dr. Soni mentioned, having long COVID. So long COVID is what I think impacts my patient population mostly. As a general pediatrician, I treat children from birth until they're 18 years old. And it's been, quite devastating seeing a lot of these teenagers that were once competitive athletes and track stars, basketball stars, hoping to get their scholarship, their college scholarship for academics this year. Now they fully recovered from COVID from the short acute phase and now having ongoing symptoms of chest pain, fatigue, intermittent fevers, and shortness of breath. So I think in the beginning of the pandemic, we were all thinking children were safe and immune from this, but now as time has gone on, we've actually been able to see how this virus has impacted their ongoing health, not just physical health, but also mental health. I was, talking with some of my co-workers who are all general pediatricians, and we commented on the amount of mental health and emotional health problems we've seen in this population. Not only are children fearful of their health and returning to school, but also fearful of contracting this illness and bringing it back home. They've dealt with, death in their family, death from their friends or extended families, and these are real triggers and stressors on their mental health that, I haven't seen before. So lots of things to consider with COVID, the short-term side effects, but also long-term effects that we're hoping that this vaccine is able to provide, some relief from.
Thank you, Dr. Monk, and thank you for just kind of connecting the dots over the things to consider as far as long-term side effects. Dr. Cho, a question for you. The Pfizer vaccine for children 5 to 11 is the same as the vaccine given to those 12 and up, but only a third of the dose. Please tell us how this vaccine is given to children and what parents can expect in terms of possible side effects.
Thanks for the question, Premere. Really, I wanted to share my excitement along with Dr. Soni, Dr. Monk, the fact that we can actually have this conversation about having a vaccine that's accessible to children. Me having young children myself, it really is, a time that we've been waiting for a while. In regards to the side effects of the vaccine, Dr. Monk kind of covered the common side effects that we're all aware of when we get the vaccine ourselves. In some ways, we can rely back on our own personal experience for those of us who've gotten the vaccine. Common side effects, local reactions, pain at the site of the injection, systemic signs like fever, chills, headache, fatigue. Those are all self-limited, and the great news is that simple over-the-counters or really just time will resolve the symptoms. So I know that a lot of hesitancy revolves around some of the side effects that people have heard about in the media, starting off with things like anaphylaxis, which is a significant allergic reaction. To put it in perspective, we're talking about 5 cases out of 1 million doses. So a really low rate of this severe allergic reaction. And it's the reason why we observe children or really any patient after they get the vaccine for about 15 minutes. That's usually the time frame in which you'll see that sort of reaction. The one big one is myocarditis, which has hit the news as well, particularly the group that's at a little bit greater risk than expected would be young males. And this is really sort of in the young adult, including teenagers. Again, to put this in perspective, it is a very rare complication. This is 40 cases out of 1 million doses administered. So we're talking, it's, if you wanted to put it in percentages, it's 0.004%. So really small. We take every case serious, and that's why we always give close follow-up instructions and monitor for signs and symptoms of myocarditis, such as chest pain and shortness of breath. But at the end of the day, the benefit of the vaccine far outweighs the risk. And we're talking about preventing infection and transmission in the community. We're talking about unnecessary pediatric hospitalizations, and really significantly, obviously, preventable deaths. In the past year, about 100 children died from COVID, and with a vaccine, this can be prevented. So, I understand the concerns that families have, but, clearly the benefit of the COVID vaccine outweighs the risks.
Thank you so much for that, Dr. Cho. Hearing those experiences, and thank you all for sharing in your excitement. I think as each vaccine has rolled out, it's been exciting to hear from a professional perspective how you all are seeing things kind of unfold. So I have a couple of questions. Did I hear someone? I have a couple of questions that are open for whoever is comfortable responding to, that I will go ahead and share. These are some questions coming in. And also, if you're interested in taking and providing additional questions, we welcome our viewers to start sending questions in. But I already had my 8-year-old vaccinated, but several of her friends aren't vaccinated at this time. What precautions should we take to keep her safe? I see Dr. Monk.
I would say I get these emails all the time, and I do the same with my friends. Even though I'm vaccinated, I know that I can still contract COVID, but the likelihood of me developing severe illness and death is low, which goes the same for the children. I would recommend that she can, expand her social gatherings, but I would still recommend face mask wearing and hand hygiene, and all the same precautions we've been using throughout all of this time to still be in place.
Thank you. Again, these are questions for all of our experts today. Another question, it is flu season. I know I took my daughters to get flu shots earlier this week. In addition to the ongoing COVID-19 pandemic, should kids in this age group also receive an annual flu shot? And can they get these vaccines at the same time?
I think that's a great question. I think this winter is going to be a lot different than last winter. With social distancing, we didn't see as many respiratory infections last year because families were staying home, keeping safe, socially distancing. As things have opened up, children are mixing, they are transmitting infections, including things like RSV and flu. The adage in medicine is to vaccinate as soon as you can, as safe as you can. So we would always advocate to get the flu vaccine in any year. And there is no contraindication to get it with the COVID vaccine, as well as any number of pediatric vaccines. We would always welcome to have those done as soon as the child and the family feel comfortable.
And I'd like to piggyback on that to what Dr. Cho was saying. In the pandemic, kids have really fallen behind, and I'm sure Dr. Monk is experiencing this in her practice with their routine childhood immunizations. And so it's really important for parents to understand that it is safe to give the COVID vaccine with other vaccinations. I think we have this kind of idea that our immune system can't handle it, their immune system can't handle it, but our immune system is very, very able to handle multiple vaccines at the same time as we do in our routine immunizations anyway. So just want to encourage parents to make sure they're up to speed with their kids on that.
Thank you for those responses. So this is very interesting because I think there is a lot of misinformation about vaccines circling online. So what are just the simple facts that parents need to know about vaccines for children? Again, there's just a lot of misinformation, and if some of you would like to just provide simple, quick facts on what parents need to know about the COVID-19 vaccine for their children.
Sure, I can start on this one. Well, first, I'd like to start by saying that, everyone's kind of on high alert because these are mRNA vaccines, something that we have not previously used before. So I just want to make a comment on that because I think there's a lot of misconceptions about the vaccine development process. And so first, I'd like to just say that mRNA vaccine technology is something that we've actually been building upon for decades. Basic science researchers have been working on this for, since the 80s. And we've really, because we were placed in the situation we were with the pandemic, that is why we have kind of taken that technology and been able to use it for COVID-19. And so I think it's important for parents to realize that this didn't just come out of thin air, and it's kind of backed on years of science. mRNA technology also, with the vaccine trials in place, the Pfizer vaccine, the Moderna for the older kids, there were no shortcuts taken with the clinical trial process at all. I think a lot of the red tape with the regulatory agencies was kind of, we didn't have to go through that as much, just so we could get the vaccine out to help save people. But there were no shortcuts taken on safety measures or making sure that this product would continue to be monitored closely as it's being rolled out.
Thank you. Okay, the American Academy of Pediatrics is recommending COVID-19 vaccination for all children and adolescents ages 5 or older. Yet, there may be parents watching tonight, even some parents that are vaccinated themselves, who are hesitant to get their child vaccinated. What would you say to them to encourage vaccinating their children?
I think we could spend a lot of time going through the barriers of why if a parent would not want to get the vaccine for their child. I think Dr. Soni hit it on the head, is that the speed at which the vaccine came out makes parents hesitant. On the medical side, I think giving the information that we have available, for example, as I mentioned, in the 5 to 11-year-old age group, we had about 100 children die. Tens of thousands of children getting sick from COVID, thousands of hospitalizations. These are, in essence, very preventable. The vaccine is very effective, and we obviously want to prevent these unnecessary issues from COVID to happen to begin with. But we do understand the concern, and that's really what it is about providing the information for them to make an informed decision. We get a lot of questions that, usually it's mild illness, but we have seen really significant and severe illness in kids. And obviously the deaths are very tragic. So, if we can do our best to provide that information and help them understand why we are concerned and what the numbers show, just like for our own children who we would want to get vaccinated, we would hope that they would want to do the same. And so that's all that we can do. But we welcome the conversation because this is where it starts.
When I ask parents about some of their hesitations in getting their children vaccinated, a lot of them, of course, have good intentions and want to protect their child. But I think it's concerning giving something that's new, or the media has just been talking about to their child that's still developing and growing. And their hopes are that they don't want to give them something that may potentially have long-term complications. One of the things I hear often from parents is a concern about this altering their DNA or even affecting fertility in the future. And I think it's important. I'm not even sure where those misconceptions came from, but knowing that we standardly give vaccines to young children. When children are born, we give them the hepatitis B vaccine, which is recommended within 12 hours of life. So we're always, giving vaccines in order to help boost immunity and to protect the children. And even, adults that have gotten this vaccine have gone on to conceive children, healthy babies. This year, we've seen a huge boom. And then we standardly give vaccines to pregnant women in order to protect them. So these are all standard things that we have been doing for a long time. Nothing that should be, parents shouldn't have any fear that these vaccines may affect fertility or have any long-term complications that may affect their development either.
Yeah, I'd just like to echo that. There have been 0 studies linking this vaccine to adverse effects of fertility for both females and males. And I just want to also say that this vaccine has been studied more than any other vaccine in the history of time, because, more doses have been given in this period of time. And within the kids, specifically the 5 through 11-year-olds, they're given a third of the dose, as you guys know, but there were 0 cases of myocarditis seen thus far in over 5.6 million doses given to date. So I think that's really, really encouraging for parents. And I think they should also remember that the risk of getting myocarditis from infection with COVID itself is 16 times more than not being infected. So I think they have to kind of put the fear in perspective with the bigger picture. It's not a question of should I be vaccinated or not, or have my kids vaccinated or not. It's, are you vaccinated or are you going to get COVID? Because at some point in this pandemic, we are all going to be exposed to this, if not already. And this is the #1 best tool we have to protect ourselves and our kids.
Thank you so much for all of you for sharing and just helping us all to be more informed on the rates and all of the outcomes that you're seeing, and being able to share that out is really powerful this evening. I have another question, fairly new. I see that Pfizer boosters have now been approved for 16 and 17-year-olds. Will boosters be required for all kids 15 and younger in the future? I see Dr. Cho. Go ahead.
Yeah, I think, it's just a matter of time. We don't want to get too far ahead of ourselves. They're researching that question as we speak. The good thing about younger patients, particularly children, their immune systems tend to be a bit stronger, so their immune response will be stronger to the vaccine. But they are asking that question about timing and whether it actually will be necessary. So time will tell. They're studying it now, and we will probably get that data out pretty soon. And from there, they'll make a decision. But I think those are important questions as we look forward. But as of now, we don't give a formal recommendation for children less than 16 to get a booster.
Thank you. Regarding the pediatric dose, is it strong enough to protect kids from variants like Delta and Omicron? I know someone touched on this a little earlier, but this is a more specific question.
Sure. So that's a great question. And when we come up with these doses, a third of the dose of the adult dose, that doesn't just come from thin air, right? So we want to hit, a sweet spot of what dose is going to give a child a very good antibody and T cell response, just parts of our immune system that protect us, versus a dose that might be a little too much, that might cause more adverse reactions after these kids get the vaccine. And so that's how, researchers and scientists came up with this third of the dose for this specific age group. I will say that it's a little too early to tell about how effective it will be in regards to Omicron and this kind of a thing. We have to keep in mind, for the 5 through 11-year-olds, this vaccine was just approved in early November. So we still need time to kind of see how this plays out, as Dr. Cho was alluding to. So we'll have to see. But, I did want to remind the parents on that these kids that were enrolled in these trials were given the vaccine or placebo and put through the clinical trial at the peak of Delta variant. And so we do know that it is very effective against the Delta variant with over a 90% efficacy.
Wow, thank you. Having kids myself, younger kids, and just being informed, I think it's great to involve the kids in kind of understanding once they get the vaccine, what can kids do once they are vaccinated? With like mandates and different things that are happening across the city.
Well, I'm happy to start.
Okay, I see you.
There's a lot of clearly medical benefits of reducing one's personal illness. But obviously there is a community benefit of preventing spread from family to, community members. But clearly, every community puts in safety measures to protect the community, including needing vaccination cards to go to restaurants or play gyms, going to school. All of the things that will get us back to some level of normalcy will require us to get the vaccination. And so children are going to be no different. For them to be able to go back to school, for example, LAUSD has put in a mandate for children that may be extended to younger ages, although there has been a delay in enforcing that. I think each area where it affects children's lives, there will be a benefit to vaccination. So if children want to go see their friends and go back to school and all the things that they want to do, I think vaccination is the first step. It isn't the only step, because clearly it's going to take a while to get to any sort of level of normalcy. So we'll still have to take significant levels of precaution, but I do think that it's the first step to get there.
Thank you.
Also, to echo that, I've seen different school districts take a different approach, requiring vaccination to compete in competitive sports. And even some of the private schools, I've seen that they mandated vaccination for the children to have indoor classroom time. So some of those kids have been able to take off their mask in the classroom and just go back to some sort of normalcy that they were used to seeing pre-pandemic.
Great. Thank you for sharing those very real, connections and experiences. So let's take some questions from our viewers. Again, we really appreciate everyone joining and listening into our experts on this matter tonight. To all of you joining, if you have questions, just a reminder about the vaccines for our doctors, please use the Q&A function on Zoom to submit them. And we will do our best to get to as many as possible in the time that we have left in our conversation this evening. So I see some really good ones coming through. The first one, and this is for all of the doctors, whoever would like to respond. Why is the Pfizer vaccine the only one available for this group? Are they the only company researching the effectiveness for this age group?
I can start with this one. So no, the answer is no. I think the other companies, Moderna, mainly have also been looking at the efficacy of this vaccine in this age group and even in the younger age group. So I think we're going to hear more from the others. But for now, the Pfizer one is an excellent vaccine, and the clinical trial and data from that trial for the 5 through 11-year-olds is great. We feel very comfortable recommending it, even though it's the only option right now.
Thank you, Dr. Soni. Moving on to other questions that we're receiving from the viewers. Thank you for sending your questions in. Considering the lower risk for children with COVID-19, how necessary are vaccines at this stage of the pandemic?
I think what Dr. Soni mentioned earlier, with children making up over 25% of the positive cases in the nation for this past week of December 9th, lets us know that children are being affected, and they are, the ones that are unvaccinated. So their ability to go to school, mingle with other people, and transmit the virus is going to be higher. So what can we do to, stop these variants from popping up and from this virus spreading? We have to make sure that we're vaccinating everyone. So this is the next step: getting the younger age group vaccinated, the age group that's going into school and that's, being more social every day. Those are the people that we actually need to protect. And even though the children that we've seen are having milder manifestations and side effects, it doesn't take away from those children that have actually died and succumbed to this illness, or the family members and the friends that they've actually transmitted the virus to. So not only is the vaccine in place to, make sure that the children in this population is safe, but also to do their part and make sure that the community is safe as well.
Thank you so much.
I think that's really key. We didn't originally think kids were transmitting as much, but they are very able to spread this virus, as we're seeing and have seen, continue to see. And so I think that's a big, sort of reason. But also, when we look at kind of other vaccines that we give, like we were talking about influenza earlier, right? So if you look at prior influenza seasons and how many children have died during influenza seasons, there's about 5 times as many deaths overall due to COVID-19. I think there's close to 1,000 children, 0 to 18, that have died so far due to COVID-19. And that's about 5 times as much as prior influenza seasons. So I just want to put that in perspective too. It is really impacting kids a lot more than we think. We think that they're making up a small percentage. If you look at the data, it's like, oh, less than 1% of kids have died. But yes, that's still 1,000 children, way more than we want to see at all. So
Great point. Thank you. Another question that's come through: my child already had COVID earlier this school year and fully recovered. Does he still need the vaccine, and why?
That's a great question that we get in different forms. Another misconception is it better to get natural virus versus getting the vaccine? I think there's this idea if you get it naturally, you're good. The great thing about vaccines is that not only has it been really rigorously studied, but it's given in a controlled